Hello, my name is Candace Doctor, and I'm currently a licensed practical nurse. I'm currently attending Western Kentucky University LPN to RN Bridge Program. My presentation today is going to be on the nursing report and handoffs, including nursing handoff reports and physician SBAR. First, the nursing field is an ever-changing field, and as technology increases and as healthcare progresses, every day someone somewhere is trying to find ways to make healthcare better for the nursing staff and healthcare providers, and better for the patient satisfaction as well. One way this is being done is by having better communication between nursing staff and how they take care of their patients, and between the nursing and the physicians and how they also take care of their patients. Anyone that has been a veteran in this nursing game as long as I have know that over the years we have seen a great increase on how we communicate with our nurses and how we communicate with physicians. When I first started nursing, we had to call the physician office. We talked to the physician's assistant. The assistant relayed the message to the doctor, and then we had to wait for the doctor to return our call. If it was non-emergent, we would fax the doctors. We would fax the doctors any requests, whether it be for a prescription, whether it be for a betadine, even for a dressing change. We would fax over lab work. We would fax over prescriptions, and then at the end of the day, once the doctor finished doing whatever he was doing, then he would sign the faxes and send them back to us, which can really prolong, treatment towards certain situations. But that's how we communicated back in the day, and now communication has improved. Now we have bolt phones, we have pagers to where you can page your doctor, he can get back to you immediately. You have bolt phones where you can even call and even text your physician. The physicians come around and see the patients a lot more often than they used to. And so communication is a lot better than what it used to be. Especially in the hospital settings. There's a little bit different in the nursing home settings, but pretty much the same thing, communication. But first we're going to talk about how we communicate with our nursing staff, with your oncoming shift. When I first began as a nurse, our communication, or how we communicate, and sometimes still in some places how you communicate information from shift to shift. You had a piece of paper, you would write down the patient's name that you have, and you would just write down information as the other nurse related to you. They would tell you, how the patient's day went. They would tell you what kind of medications and the doctors. But a lot of time things can get missed, as far as how we communicate. According to the Australian Council for Safety and Guidelines in Healthcare, ineffective handoffs can lead to reduced patient safety by leading to wrong treatment, delay in diagnosis, outcomes that can negatively affect the healthcare system. The harm produced by ineffective handoffs include wrong treatment, delayed diagnosis, life-threatening adverse events, increased length of hospital stay, and other effects that negatively impact the healthcare system. The way that we used to communicate between nurses is we would just tell each other how the day was, what we could remember about the patient. And a lot of times, a lot of things would go miss. A lot of times we didn't know the code status of our patients. We may not have known all the medications they were on, or even the history of the patient. If you think about it, if I have, in a hospital between 4 and 5 patients, without me having everything written down, it is really hard for me to remember everything, every diagnosis, every vital sign, every medication, every new order the doctor put in. And so things would get missed from nurse to nurse. And if I forgot to tell nurse B is also going to forget to tell nurse C. And a lot of things are getting missed. And that's how, sometimes we had a lot of delays in patient care, and patient satisfaction was very poor, and how we take care of our patients. And so now, the Joint Commission has come up with more ways on how we can communicate with our patients. Now, every place is different, whether it be the hospital, whether it be different hospitals or different healthcare settings. there's a tool that's set up to help us to better communicate. And I'm just going to show you an example from the tool from my hospital. This is our bedside nursing report. It might be kind of hard to see, but on there, and I've got marked out the names, there's no HIPAA violation in place. But on this, we have, it gives you information about your patient. So on this, and I get one for each patient that I have. It has my patient's name. It has my patient's birth date. It also has the code status of the patient. How great is that to have the code status of your patient? How many times have we been in a situation where something went wrong and we don't even know what the code status of our patient is? That's not very good nursing practice. This here helps us to know that. It also tells us, you know, the falls risk score, which is important to know whether your patient needs a bed alarm on, because honestly, we're human. Sometimes the patient may forget, the nurse assistant that was in there earlier may forget to put the bed alarm on, or the nurse may have really forgot to tell you something. But this is a great way for us to always know everything that's going on with our patients. And so it has our patient's name. It has the admitting diagnosis, why the patient's here. How many times have you given a report and not remembered why the patient's even here, and then you have to go look it up? No, this tool provides the information on why your patient's here. It also provides their allergies. So you'll know that. So if the doctor orders a medication right away, you can say, oh, wait a minute, doctor. She's allergic to this. She can't have this. You know, it tells you their last blood sugar, which is great for diabetics. It tells you what kind of IV site they have, whether the patient is alert and oriented, if they're on oxygen. Now, this gives you places where you can write it down. So this gives you a reminder to ask your oncoming nurse or outgoing nurse, okay, well, is the patient alert and oriented? There's a sign here for that. Is the patient on oxygen? That's something that you might want to know. How are their bowel sound? Are they continent? Are they incontinent? Are they able to ambulate? Do they wear TED hose? Do they wear SCD hose? These are very important information. Are they on bed rest? You know, lungs, are they clear? How they sound? Even though we have to assess our patients, it's nice to have a reference to go back to say, well, on day shift, the nurse says the lungs were clear. And here on night shift, now I'm hearing crackles. That's a change that you would want to have to really know about your patient. It tells you about the edema. It tells you about, you know, about cardiac monitoring, and even has a place for you to put the patient's vitals. You know, you don't want to administer a metoprolol and don't know what the patient's blood pressure or heart rate is. You know, it also gives you the history of the patient. So that is always great to know, especially if you have a doctor in your face asking you, hey, why is Miss Brown here? What is the reason she's here? Does she have a history of AFib? You know, so this is very important information that we have to know. And all this is a great communication tool between nurses. And according to the research that has been done by Joint Commission and by the Australian Council for Safety and Guidelines, it has also proven that it has made better patient satisfaction between the nurses and between the doctors and between your patients. Now you know more about your patient, and it's never a question. You know, you're able to, it gives you plenty of space to write down things that happen, new orders that the doctor has been giving you, that happened through the day, tests that the patient may have went. You know, and all that's very important, and it increases the level of care that you give to your patient. It increases the quality of care that you give to your patient. And that is very important when it comes to healthcare, to provide a safer environment for our patients and also for your nurses. So not only is it important with nursing on how we communicate to each other, but it's also important to how we communicate with our doctors. So, you know, no doctor ever wants you to call them and don't know everything that's going on with your patient. Have you ever called the doctor and the first thing the doctor says, well, you're calling about a patient having a temp of 101, and the doctor says, well, what's the heart rate? You don't know because you didn't get the vital signs. Or the patient asks, well, what kind of medication, or the doctor asks, what type of medication that he's on? Or, you know, well, what's the history? And you don't have all the information in front of you. That provides a very angry doctor and makes you look kind of foolish, you know. But it decreases the level of care that you can give to your patient. And, you know, and also it decreases how many times that we call the doctor, because it's easy to say, oh, I forgot to ask him that when I called. Or, oh, I forgot to tell him that when I called him. And so the Joint Commission, if you go to jointcommission.com, they came up with a tool called SBAR. S standing for situation, B, background, A, assessment, and R, recommendation. This is a tool that they came out with in the year 2013 and how we can better communicate our needs to physicians. So when the physician when we call the physician and he calls us back and is wanting information about his patients, this tool, if we have it filled out correctly, will have everything that we need. So SBAR situation talks, it asks, what room the patient is in. It asks you to put down the admitting diagnosis. If you're calling the patient, you're calling the doctor and saying that the patient has uncontrolled AFib, all of a sudden a heart rate of 124 when initially he had a heart rate of 79, they're going to want to know, well, why is the patient here? Because we have to understand that although we may only have 5 patients or 4 patients, the doctor has about 20 or 30 or the whole hospital or the whole facility. We don't know. So it's hard for them to actually know what patient you're saying just by name. So this provides information about the history of your patient. So the situation, why are you calling the doctor? What do you want from them? What's going on with your patient? That's very important that you want to tell them. Well, my patient's having a heart rate of 124 and right now he's in uncontrolled AFib and he was in sinus rhythm earlier. Background is asking the allergies. If the patient have any allergies, you don't want the doctor to order an antibiotic and then later find out that they're allergic to the antibiotic, and then you have to call them back and say, hey, you know what, I'm sorry that you ordered Levaquin, but the patient has an allergy to that. You want to have all that taken care of in one phone call. And so they gives you the allergy, their advanced directives. They always want to know, are they a full code or are they a DNR? That's very important that you want to put on there. They have any infections, C. diff, MRSA, ESBL. That's important too, especially if you're talking about a patient's white blood count being high. Are they on any antibiotics? The history. If I'm calling about uncontrolled AFib, do they have a history of atrial fibrillation? If not, that's very significant. Then the doctor may want to know, do I need to start them on cardizem? Is this a history? Have they always been in atrial fibrillation? Assessment. Well, one of the most important things that you always want to make sure that you have when you call a doctor are their vital signs. And so this lets you make sure that you get the vital signs on there. Is the patient in pain? The last medication that you give, have you given the cardizem today or metoprolol today or anything like that, some type of beta blocker? And the time that you've given it, when was the last time the patient had it? When did the patient go into atrial fibrillation? What kind of IV does the patient have? Do they have an IV? Are they getting any blood? All this, are they alert and oriented? What type of rhythm are they having? Are they on oxygen? Are they on a BiPAP at night, or continuous BiPAP? What does their skin look like? Anything that's pertinent to the reason why you're calling the doctor should be filled out here in this assessment, because guarantee you the doctor is going to want to know information about that. And then recommendation. That's for you to recommend what you might think that the doctor may need and for you to listen to what the doctor ordered. And whenever you listen to what the doctor ordered, you always want to make sure that you repeat what the doctor says. That way you can verify the order. But this gives you, the next, it asks you pertinent lab tests. Well, their last PT-INR was yesterday and the INR was 2.3. Their last CBC was yesterday and it was 12. That's information they want to know. So they know, do I need to recheck any labs? Do I need to check? Do they have any more scheduled labs? Do they have a CBC scheduled for the morning? Do they have a PT-INR scheduled anytime soon? Are there any critical lab values? That's all to be part of this recommendation. Does she have a critical, BNP, that might be pertinent to the reason why this patient is having heart failure at this time? Any high alert meds for AFib? Are they on cardizem? Are they on any type of beta blocker or anything that should be slowing their heart rate? Because you don't want a doctor to order metoprolol or cardizem, IV, and they're getting cardizem PO as well. You want the doctor to know that. And so all this is very important information that you give to the doctor. This tool here has provided a better communication between doctors and nurses and has allowed us to communicate effectively, not to miss anything, and to better take care of our patients. It helps us to understand what's going on with our patients, any type of reporting, whether it be bedside reporting or with the nursing or SBAR. It helps us to better understand our patient, and it helps us to better effectively communicate what's going on with our patient. That way it decreases any type of situation as far as harm produced. You know, it decreases the length of the hospital stay of the patient. It decreases anything that can negatively affect their health care. It provides quicker hospital stays, you know, quicker reaction time to critical situations when we know exactly what's going on with our patients. So SBAR and bedside communication or handoff reporting are very important when it comes to how we communicate. It's important in how we talk to our nursing staff and how our doctors, and it's important on how we tell what's going on with our patients. Without it, it's so easy to miss things. It's so easy to forget things, which can definitely be detrimental in our patient care. Thank you.